Welcome to OpenBXRX Tuesday on BronxNet. I'm your host, Sonyi Lopez, and I'd like to invite you to get social with us at BronxNet TV on Instagram and Twitter, and BronxNet Community Television on Facebook. Healthcare is a human right that may not be accessible or affordable to all. In an effort to bring low-cost to no-cost healthcare access to New Yorkers, NYC Care provides services at New York City Health and Hospitals facilities. Joining us now to share what you need to qualify and more is Marielle Kress, Executive Director of NYC Care. Welcome, Marielle. Thank you so much for joining us today.
Thank you so much, Sonyi, for having me. It's a pleasure to be here.
Happy to have you. So, of course, to start, Marielle, for those who are not familiar, can you tell us about NYC Care and your mission?
Absolutely. NYC Care is a healthcare access program that provides low or no-cost services to New Yorkers who don't qualify for or who can't afford health insurance at New York City Health and Hospitals locations all across the 5 boroughs. So we're really providing a comprehensive set of benefits to people who have historically and previously not been able to access care because they're unable to access insurance.
Thank you for expanding on that, Marielle. And when we consider some of those issues and obstacles that people face, particularly here in New York City, when it comes to accessing healthcare, how does this program seek to address some of these, especially during the pandemic when people need healthcare the most?
Absolutely. Thanks for the question. So we know that access to healthcare has always been incredibly important, particularly for our most vulnerable neighbors and New Yorkers. And that's become even more apparent in the pandemic, how important it is to have access to ongoing life-saving care. We know that most of our members, we have around 75,000 in the program right now across the 5 boroughs, live in the neighborhoods that have been hardest hit by COVID-19. And so previously, a lot of the barriers to access have been affordability and really knowing what you're expected to pay when you come see the doctor. So our membership card lists your specific fees that you're expected to pay to come see the doctor. And people who are living below the poverty line don't have to pay anything to come see the doctor. So it's free and accessible. And we want people to access the services that they need without fear of the cost or worry about their immigration status as well. And I think also language has been a real barrier. So our contact center has agents in multiple languages. All of our materials are translated into multiple languages, and we really prioritize language access through the program.
Thank you for sharing. And what are some of those services that members can access through NYC Care, Marielle?
Absolutely. So we're really prioritizing access to a primary care provider. So we're offering all new patients who enroll in the program an appointment with a primary care provider within 2 weeks of enrollment. And that primary care provider can help folks get access to specialty care. So if you need to work with a cardiologist or a podiatrist, if you have diabetes, can really manage those chronic conditions that folks have, provide access to pharmacy benefits. So lots of different prescription medications, also 24/7 access to prescription medications. And really all of the services that New York City Health and Hospitals provides through its facilities.
Yeah, sounds wonderful. So you did mention that NYC Care is not an insurance plan. How is it different from insurance, and can it substitute insurance? I also see that members receive their own membership cards. It looks like an insurance card, but it's not quite that.
Yeah, exactly. So NYC Care is not an insurance program. It's a healthcare access program. And part of the way that individuals get access to the program is that we actually screen people for insurance first, because we really want people to enroll in insurance if they're eligible for insurance. Insurance does include a broader network of providers. So individuals who are accessing services through New York City Health and Hospitals are accessing them only at New York City Health and Hospitals locations. But unlike insurance, there are no premiums or monthly fees that one has to pay. So, we want people to enroll in the program that they're eligible for. And when they come to see us, if they're uninsured, we'll help them either get connected to insurance, or if they're not eligible, NYC Care.
Got it. Thank you. So when we talk about the services and how much we have to pay, how are those payments determined?
Yeah, absolutely. Yeah, so our sliding fee scale is based on an individual's income and household size as well. So individuals who are making less than around $13,000, so below the poverty line, are not paying anything to come use our services and see our doctors or go to the emergency department or get inpatient care. So any of our services, if you're under 100% of the federal poverty level, are free, and our medications are $2 per prescription. And then it goes up from there based on your income and household size.
So do all hospitals in the Bronx currently accept NYC Care?
So the New York City Health and Hospitals locations in the Bronx accept NYC Care. So our locations include Lincoln Hospital, North Central Bronx, and Jacoby. And then we also have a really extensive network of community health clinics all across the Bronx. We even have opened a really beautiful new clinic in the Tremont neighborhood that is a COVID Center of Excellence. So we're providing enhanced care for people who have experienced COVID and maybe still experiencing symptoms, but also really great access through that clinic for anyone who needs primary care services as well.
Wonderful. And Marielle, when we talk about the qualifications, what are some of those requirements? What do people need, to apply? Who qualifies in general?
Yeah, absolutely. So, like I said, we're going to help people identify anything that they're eligible for. So, if you're not eligible for insurance and you live within the 5 boroughs of New York City for 6 months, then you're likely eligible for NYC Care. So, we'll assist you with going through the New York State of Health insurance eligibility process. We'll see if you're eligible for anything through that marketplace or Medicaid. And then if you're not, or you're only eligible for Medicaid for the treatment of emergency services, and you meet the other eligibility criteria, then you can enroll in NYC Care. That process includes producing proof of your identity, where you live, and also your income. But our financial counselors, when you call, you'll get connected to a financial counselor who will help you go through that process. And our financial counselors are really skilled at helping people produce those documents that I just mentioned in all different types of scenarios. So if people are not paying taxes or they're receiving payments in cash, they will help you get the documents that you need in order to work through the process. So if you don't have documents that are listed on our website, don't worry, we'll help you.
Got it. Very helpful information, Marielle. I also wanted to stress, you did mention this earlier, but can we discuss the eligibility for NYC Care despite immigration status? I know a lot of our Bronxites are concerned about not qualifying for health insurance or, any type of medical help if they're not documented. Can you stress a little bit on that, please?
Yeah, absolutely. So folks are eligible for NYC Care if they are unable to afford health insurance based on federal guidelines, or they're ineligible for health insurance. And largely in New York, the folks who are ineligible for health insurance are ineligible because of their immigration status. And so, many of our members are undocumented, and we invite anybody, regardless of their immigration status, to come to seek care at our facilities, to enroll in our programs. We keep all of our information confidential. The information that you're providing us is only used to determine your eligibility for various healthcare products, insurance, or NYC Care. And confidentiality is really at the core of everything that we do. So please come and seek care regardless of your immigration status.
Thank you for emphasizing that, Marielle. And before we go, finally, I know people are tuning in and they're like, how can I enroll? Where do I go? How can people enroll for NYC Care? And where can we go to find out more information?
Yeah, absolutely. So you can find out more information on our website, which is nyccare.nyc. And if you're ready to enroll, you can call our phone number at 646 NYC Care, which is 646-692-2273. And our operators are there 24/7 in multiple languages to assist you with enrollment. And please join the thousands and thousands of other New Yorkers who have already enrolled and are seeing the benefits of the program. We have people who have chronic conditions who are experiencing control of their chronic conditions. We have people who have never come to see a doctor in this country despite being here for decades. And it's really changing people's lives to access that care and have that peace of mind.
Just out of curiosity, Marielle, when did the program launch here in the Bronx in particular?
Yeah, so the Bronx was our first borough. We launched in August. We launched in August of 2019 in the Bronx. And then we've gone to all of the other boroughs. So we're live in all 5 boroughs. And even if you see a provider in the Bronx, but you need a specialty service at another clinic or another hospital, you can access services at all of our clinics and facilities all across the 5 boroughs, regardless of where you live in the city.
Wonderful. I'm glad to hear that we were the launching pad, the launching borough, the first to receive the services. And thank you again, Marielle, for your time today and for sharing more information. One more time for our viewers, how to sign up, how to enroll before we go, just in case, someone went and walked away for some water or something and needs that information again.
Absolutely. So call us at 646 NYC Care, which is 646-692-2273. You can call us 24/7. We'll serve you in multiple languages, and we'll help you get enrolled in the program and start accessing services.
Perfect. Thank you so much, Marielle, again for your time today.
Thank you so much for having me. Have a great day.
You too. Marielle Kress is the Executive Director of NYC Care, NYC Health Hospitals. We'll be right back here on Open BXRS Tuesday.